Good morning, Kentucky. We are here to provide our 9 a.m. update on our efforts to address the coronavirus. I want Kentuckians to start thinking a little bit differently about what the next couple months are going to be like and about what our job is. You know, I've been talking a whole lot about Team Kentucky, about coming together to do the things we need to do. Well, this right now certainly is a big test for Team Kentucky. This is us against the coronavirus. And all we need from people is to be really good teammates. Understand that we've all got to follow these guidelines. We've all got to go through this disruption we're going to see over the coming weeks if we are going to be effective in how we address this virus. James, can you put up the slides we showed yesterday on the curves? Once again, what we are trying to do is to lessen the contacts that people have to at the least slow the spread of the coronavirus, though I believe that we could lessen the cases of coronavirus, and it's certainly my hope that we can. But to make sure that we are not the business as usual curve, we need everybody's help and buy-in to get the type of impact that is going to protect our seniors and is going to make sure that we get through this and hopefully get through it in a timely fashion. Once again, we're going to be okay. We're going to come out from on the other side of this. We are going to beat the coronavirus, but we need everybody's help to do it. Now, there are good teammates, which we need everybody to be, and sometimes people don't live up to being good teammates. As you all know, there's an NBA player named Rudy Gobert that has since apologized and mentioned his actions about being a bad teammate. I actually want to show you that video. Or try to. You got it, James? Why don't you go ahead near the, oh, there we go. So this is somebody who was not taking the coronavirus seriously, that engaged in types of activities that were likely to spread it, and he has since apologized, and we accept that apology. We want to be compassionate, but we need everybody out there to be a good teammate and not to engage in the types of actions that can otherwise spread this. Remember, we have two duties. The first is to protect ourselves and our families, and the second is to make sure we don't do what Rudy Gobert did, and that is to spread the coronavirus to other people. Here's where we are as of this morning. We have overall tested 118 people in Kentucky. We have 11 positive tests. James, can you cut that noise? We've tested 118 people. We have 11. I cut the microphone. We're all adapting. There we go. We've tested 118 people. We have 11 positive and 107 negative tests. The breakdown is we have 3 positives in Fayette, 6 positives in Harrison, 2 positives in Jefferson County. We expect more positives as the days go on. Of the 3 newest cases, the Harrison County case is a 51-year-old male. The Fayette County case is a 31-year-old female. And right now, we still need to confirm the Jefferson County case, so we can't give out those demographics, not having them personally ourselves. Want to go over the steps that we've taken, and we're going to announce a few new ones today, like we're always going to have a little bit of additional guidance. We declared the state of emergency to give ourselves all the tools we need to address this coronavirus. It allows me to first tap into a $4.5 million fund in the budget, and then the Budget Reserve Trust Fund to ensure that we have what it takes to address this virus. We activated the Emergency Management Operations Center and the State Health Operations Center. We announced the Kentucky COVID-19 hotline. That number is 1-800-722-5725. Now, I will say, and I think we're going to play this tomorrow or the next day, you do have to press a button in listening to the recording to get directly to those that you can talk to about the coronavirus. We had to take our poison control hotline and turn it into the coronavirus hotline. So make sure if you get on and you want to ask those questions that you press that button. Maybe at 5 today we can play it just so that you all can spread to your viewers exactly how to do it. We want anybody who's nervous and has questions to be able to ask them. We launched this website, which is the definitive authority where we are providing all our guidance and all the official numbers. It's kycovid19.ky.gov. I issued an executive order to prohibit price gouging. Those that see price gouging should call 888-432-9257. I adjusted the state's sick leave, and I'm asking other employers to do the same. Make sure you don't have a disincentive that drives people back to work because they feel like they have to support their families. We published the CDC guidelines, and we continue to do those. Those say that people over 60 and those with heart, lung, or kidney disease or compromised immune systems, diabetes, are especially vulnerable to this virus and need to take steps, certainly for those populations, but at this point, for everybody else, we'd encourage that you do not fly, and whatever you do, don't get on a cruise ship. We're recommending social distancing for everybody now. For a complete list of guidance, it is on our website that is here. What that means is we need to make sure that we avoid crowds in the coming weeks, and that we try to have a 6-foot distance between us as often as we can, and that we wash our hands very, very often with soap and water. We wash them for more than 20 seconds. We engage in the type of good hygiene that we need. We have issued executive orders and worked with Medicaid to try to remove any financial barriers to testing. When testing becomes more widespread, we want everybody who wants to get a test to be able to get a test. We are not there yet. The nation is not there yet, but we want to make sure that first we tell everybody that that is where we want to get, but that we're also going to do what we need to do for once we're there, for it not to be a financial hardship. We've put an infographic, if you go down a little bit, James, on our website that is really important right now. One of the things we have to ensure is that we don't overwhelm our healthcare system. And what that means is we can't flood our healthcare system with people who are well or people who are sick but otherwise would not have sought care. So what that means is if you're well but you're nervous about the coronavirus, don't go to a healthcare facility. Call the coronavirus hotline. If you are sick but would not have otherwise gone to a doctor, it is allergy season. There are still colds. Everything else is still out there. Don't go to a healthcare facility. First call the coronavirus hotline. But if you are sick and you would have sought medical attention, or if you are injured, then do go to that healthcare facility. Don't stay away from it because you were concerned about the coronavirus. We are talking to all 120 county judges. We have had calls with all of our jailers. We have restricted all visitors from our prisons. We have advised our long-term care facilities and nursing homes to restrict visitors except for end-of-life situations. We signed an executive order that allows pharmacists to refill prescriptions up to 30 days. And if we need to stage pharmacies outside of their current locations, we can do that. And we have instructed our school districts to cease in-person classes for at least the next 2 weeks, starting on Monday. We've advised all community gatherings should be canceled or postponed. Anything that can be done virtually, over the phone, can be broadcast over the radio or on TV. It should be done that way. We don't want to be, and you don't want to be, the community gathering that ultimately ends up spreading this coronavirus. We're encouraging all businesses to allow employees to work at home if possible. If not possible, people should spread out at work, spread out in meeting and workspaces. If you have a meeting at work and everybody has a phone in their office, do it by the phone. Take as many precautions as you can. If you can stagger people at work, you ought to do it to thin out the numbers that are there. So those are the steps that we have taken. We have a few more today, and we're going to continue to have a few more as we go forward. The first involves senior centers. So Kentucky currently has 195 senior centers and senior nutrition sites statewide that prepare about 8,000 meals a day. The senior centers provide 4,800 meals to seniors on site, and about 3,200 receive home-delivered meals. Due to the recommendations of the CDC for social distancing, because these are the most vulnerable, we are recommending temporary closure of all of our senior centers to in-person activities. Area agencies on aging and independent living have submitted plans already to modify their delivery of meals. We're going to do everything we can to either deliver them at home to these seniors who rely on them or through drive-through meals at senior centers. The staff at the senior centers are prepared to either deliver the meals, or we are working to set up ways to provide them. And Harrison, Fayette, and Nicholas County senior centers have already closed, so we have a little experience in what this is. So the Department of Aging and Independent Living is able to transfer 19% of meal funds already to a home delivery setting, but I'm going to use our state of emergency to fund whatever other part that we need to try to provide every meal that would have been provided to a senior at a senior center and make sure they get it one way or another. But for those related to these seniors, also do what you can to make sure that their needs are being met. Again, this requires us all to be good neighbors, and this is an example of how we don't panic, we work together. We are a part of Team Kentucky. We look out for each other because the fear of not checking on a homebound senior would cause more damage in the Commonwealth than we believe this coronavirus ever will. Next, effective immediately, the Kentucky Employers Mutual Insurance, KEMI, will provide wage replacement benefits for first responders and medical personnel who have been quarantined for COVID-19 as a result of their increased risk of exposure in the course of their work. Our healthcare employees, they are doing a spectacular job. Now, in a situation that has otherwise invoked fear in some, and it shouldn't, we'll get through it, but they have come to work every single day to do their job, and some of them now are in self-isolation because they came to work to do their job. We are going to make sure that they're not going to lose money because of that. We're going to step up and do the right thing, and that should also give confidence to our healthcare employees that are out there that we're asking them to do this. If they end up having to be at home because of their work, we're going to take care of them. Last bit, teleconferencing. We're putting out new guidance for state boards and commissions. We're asking them to cancel in-person meetings and instead use video teleconference technology. The new guidance provides that boards and commissions should provide the public with a link to access the meeting remotely. This new guidance implements a 2018 change to the Open Meetings Act and allows the public agencies to comply with the act using video teleconferencing technology. We have worked with the Kentucky Press Association. We have told them about this plan. We ran it by John Fleischecker, who almost all of you know because you use him. And we believe that this is a plan that complies with the Open Meetings Act and is the very best we can do during the course of this coronavirus outbreak to make sure we can continue the work that needs to be done as we move forward. With that, any additional? With that, we're going to open it up to questions. I'm going to start because I closed with them last time to questions from those that couldn't be here today. Most people can't see the room, but we're continuing in this media room to take additional precautions. We're limiting the number of cameras, but giving everybody a feed. Many of the reporters are still here. We're just trying to spread people out more and more. So we're going to take more written questions that I'll answer here in case there are follow-ups, and we will all adjust the best we can. So the first question is, does the administration have recommendations for funeral homes? We are working on that guidance, but again, practice social distancing. And I know that's tough because this is a time where loved ones need each other, where they lean on each other. My granddad ran a funeral home. This was part of our family. But during this coronavirus, we need to make sure that we spread people out. We try to limit the numbers of people at them. And if that means having a smaller funeral now and a larger gathering once we are through this to recognize that person again, I believe that our loved ones would want us to all be protected and would more than understand some basic steps that we would take. Practice really good hygiene in those locations, and let's make sure, again, that we're protecting each other. A second one is about the tax filing deadline, April 15th. We would await any word from the federal government about whether they're going to move it. If folks are going to be home a little bit longer, I'd ask you to do two things. Number one, use some of that time to file your taxes. It's really helpful for us here in Frankfort to be able to use that revenue. And number two, answer the census. You're about to get that postcard in the mail. It's absolutely critical. Take just a little bit of that time. And I tell you what, if your kids are home, show them the census. Show them the importance of it. It's a legal requirement for all of us. It's like taking your kids to vote. And we're going to need all of us to look for activities with our kids that continue to promote good habits, good citizenship. And that's one thing that you can do with them. The next one is when I recommended closing school districts. Do I have a stance on whether teachers should still be in their classrooms or if they should work from home? So any employee out there that can effectively work from home and that works for the business or for the school, they should be allowed to work from home. There are going to be areas where we need people to come in. Again, just practice social distancing. If you can do a meeting over the phone with people in their rooms or in their desks as opposed to in one small or even big room, do that. Practice good hygiene. If you can cut down on the numbers of people coming in each day, we would suggest you do that. We are doing that in our own governor's office and across state government. We have certain functions where we have to have people that come in, but we're going to try to stagger that and spread people out to control the spread as best as we can. We had one reporter who sent 7 questions. I'll do about 2 of them, and then we can take others. Is there evidence of community spread of the coronavirus in Lexington and in Cynthiana? We certainly believe there is in Cynthiana, but we believe this is community spread, and whether or not we have the direct evidence or not, we believe it's happening. Everybody ought to be prepared for it. We are going to have more positive tests, but for about 80% of people, you're going to be just fine. You're probably going to be asymptomatic, and you may never be tested. But this is about doing what it takes to make sure we can alter that curve, not have a spike of cases. And if we don't have a spike of cases, we have the resources to try to help everyone who gets truly sick. And then have all of the coworkers of the patients testing positive been informed of this? Well, our epidemiologists certainly work to reach out to everybody that can be reached, and businesses do too. But remember, just because you've been around someone that has the coronavirus doesn't mean that they have spread it to you. That's really important. It's really important because we have to act with compassion to people who have it, and we also have to act with compassion to people who get nervous about getting it. And it's critical that we remain calm through it. There are going to be people at your workplace or in your community that ultimately get this coronavirus. It's going to be okay. You're going to be okay. Your kids are going to be okay. Let's just make sure that when someone gets really sick, they get the attention that they need, and that we don't spread it to the most vulnerable populations. And then the last one is there evidence that this week's closure of Harrison County schools has limited the spread of COVID-19 in Harrison County. So it's going to probably take until the end of this for us to have actual data, but there is no question that not having that many people, that many young adults and kids in that close of a space would have had a positive impact on Harrison County. It was absolutely the right decision that their superintendent made, and made early, and we believe it's an absolutely necessary decision we've made with Kentucky's other public and private schools. All right, with that, ready to take questions.
Governor, I know signs start getting put on the door here yesterday on the Capitol door. If you're sick, stop, don't come in.
Right.
And the rest of that. Are you looking at imposing any more restrictions on access to this building?
Well, as we move forward, we will continue to look at the best guidance we can and implement the changes we need to at the Capitol. At the end of the day, I'm going to have to do what we need to do for a place of business, which this is, to do everything we can not to spread the coronavirus. Now, I will admit that's tough. That's tough because I want everybody who wants to come through the doors of the Capitol to be able to come through the Capitol. We've never dealt with something like this before, and my number one job is not to do what is politically popular. It's to do what I have to do to protect our people. So we'll continue to keep you advised, and we'll continue to provide the best guidance we can. Chris.
Yesterday in the midday news conference, I asked you about that, and you said you were not at a point yet. Lawmakers are not in session today and not in session Monday. What do you think about that choice? Were you involved in those conversations, and do you think this is going to impact the rest of the legislative session?
So they advised me of it, and I agree. We don't need to criticize groups that are taking steps that they believe are needed to address the coronavirus. It's definitely going to impact this session in some way. I want to be able to talk through different thoughts with them. I mean, what we absolutely have to have in this session is a budget. It is the only thing we absolutely have to have in this session. Now, there are other big needs out there. I understand that. But getting that budget passed is absolutely critical because we also don't know exactly how long we're going to be dealing with the coronavirus.
Will you ask them to end the session early if they can get you a budget early?
Well, what I would say to them, and we've got to talk through this, is if they can limit the number of days and get what's absolutely critical done, I think everybody would look at that as a possibility. That's going to be decided by legislative leadership. I'll talk with them through all the scenarios, but that's ultimately going to be their call. But I'm going to be supportive of steps they take, and there may be other steps that they can take to protect those in their membership that especially fall into the most vulnerable populations. Yes.
For family members who have loved ones in, say, an assisted living home that still have access to go in, but they're concerned they might have the coronavirus, are they going to be accepted to have a test done at a hospital even though they're not presenting symptoms?
Anyone who believes they might have the coronavirus should not visit a senior relative. Somebody else can go, can meet those needs, call a friend, call a family member. We're not at the point right now where testing can be available to someone who is nervous or potentially somebody who is perfectly healthy. So again, we have to think about our two duties that I keep mentioning. One is to protect ourselves and our families, but number two is to protect other people. And so especially when you are around those that are most vulnerable, practice that social distancing. Realize that we have an obligation here. It's Team Kentucky. We keep talking about it. You are a teammate in our battle against this coronavirus. We're going to win, but we need you to be a good teammate in how we go about it. Let me also mention that especially as the next weeks come up with kids not being in class, social distancing is not isolation. And isolation is not what we're asking for, and it's not healthy. Kids ought to continue to have a schedule, so should adults. You should continue to get outside. It doesn't mean that you close down your life and you hunker down in your home. It's just that you practice good hygiene, that you avoid crowds, you stay 6 feet apart from folks as much as you can. And let me tell you, that sounds like a lot when we say it. But I'm about 6 feet from, or a little less, the closest reporter that's in here is Tom Latek, and we're talking in our normal voices, and we can have a normal conversation. And so for everybody's mental health, because our mental health is going to be tested during this, we're not asking for isolation unless you are sick. If you are well, what we're asking is just to take the important steps that we need you to take, and stay healthy. Get physical exercise. Make sure that you're taking care of your mental health needs. Those that are lucky enough to be in a stable home, enjoy time with your kids.
Do you have any guidance for superintendents and teachers who are being asked to report even though schools are closing, their concerns, but they're having to go in even though they feel they can do their work at home?
We're working through all of this, and I hope everybody, both in remaining calm and also understanding, that every day we're putting out new guidance. We just had a question on funeral homes, and every day we're learning a little bit more. There are some essential functions that schools provide that we don't want to stop. Those include meals, unless they can be provided in a different way. There's family resource centers that provide really important services. There's mental health counselors and others. So what we'd ask is use good judgment, spread out, and for employers and superintendents where people can work remotely, do your best to allow them to work remotely. Think about practices where you thin the number of people that have to be in a building at any time. Eat at your desk. I know that sounds like a small thing, but it's a big thing. That's where people congregate the most. And so here in the cafeteria in the Capitol, we haven't shut down the cafeteria, right? We're continuing the food service. What we did is we shut down all the tables where the vast number of people would congregate.
We're
Chris.
getting a lot of questions into our newsroom about daycares.
Yeah.
And whether daycare should stay open or what some of these parents are going to do with these schools closed. What
Right.
can you say?
We're going to have more guidance on that, but what we need is as much as possible for us not to be congregating people, children, young adults into small areas with significant numbers, and that's going to be a real challenge, and we understand that. So we hope that business provide the flexibility for parents to work remotely as much as possible. Those are the best situations, and then we're going to do the best we can in providing guidance for all of those other things like daycare as we move forward. Yes, sir.
All right. I apologize, you've already kind of answered this. You mentioned you want to get to the point where anybody can get the test if they want it. You also mentioned Rudy Gobert. I want to bring up the point that 58 of his teammates, colleagues, coworkers got tested in a matter of hours.
Yeah.
Can you help us understand why, in a matter of hours, 58 people, that's over half the amount of people that have gotten tested in Kentucky, over the course
Right.
of the last few weeks? Can you understand that?
And I don't, I can't give you an explanation of why the rest of the Utah Jazz and the organization immediately got tested. They were in very close contact, but for those that are asymptomatic and extremely healthy, when you look at them, here I will tell you this: myself having no symptoms, I have not been tested. We've got to make sure that we are using those resources where they're needed here in Kentucky, which is what we're doing at the moment, making sure that those who are truly presenting symptoms that fall within the CDC guidelines and that in clinician judgment need it, get it. I know there's folks out there that really want to test that right now. It's not possible. Let me tell them that I want to get to the place as quickly as possible that we can until we are at a point where everybody can be tested. We got to look out for each other, and that means making sure the resources are there for those that need it the most.
So for the people, for example, that work at the Cynthiana Walmart or the Humana, in Louisville, would they be, I guess, more accepted into getting tested?
So what is often recommended, and it all depends, is that someone that we know has had direct contact should be in self-isolation, and if they are not presenting any symptoms over a period of time, that may do it. But let me ask Dr. Stack to answer that one.
Thank you. So just to make this clear, the question's about when we test. So we got a wonderful medical system with a lot of things we can do, and unfortunately not all the things we do are always necessary. And so I'm looking at two reporters here. I think it's Chris and it's Tom. If one of you is A negative blood type and another's A positive, you're going to be that today, you're going to be it tomorrow, you'll be it till the day you die, and you were the same thing the day you were born. So if I run that test, it's the same forever for you. For a test to screen for an infectious disease, that is not the case. So you can start having symptoms but not yet have a positive test because what we're looking for in your bloodstream is not high enough. You could be normal and healthy and have the disease because outwardly you look fine, but you have the disease. So the reason I say this is, while we want everybody to have access to tests, and while we hope the people who run large laboratories can get that up and running fast, we even then wouldn't really need to test everybody. There'd be people who are tested for reassurance, but it has to be reassurance put in context so they understand that if you just came in contact with someone 3 days later, you may have a positive test, but if I test you right after you came in contact, it'll be normal. So we have to understand how we use the test, and there's a lot of complexity that's hard to get out in this venue. So all I can say is the test is not yet unlimited. We want the test to be unlimited. We have voiced our concerns and our needs to the federal government to work with the partners who have the resources to make it unlimited as fast as we can. But until that happens, and even when it happens, I ask you to trust the healthcare providers and those of us who are trying to give you credible information that the test itself is not a silver bullet. It's a really powerful tool that we need, but it has to be used with care and thought for when it's beneficial, not just a confusing piece of information.
And I'd add, we were able to announce yesterday that we've gone from 1 to 3 labs that are providing testing. We still have to, for a period of time, confirm positive results from other labs, but we now have LabCorp and U of L. We ran, I think, the largest number of tests that we have run in a single day yesterday. Each of those groups is running some. So we have more available, but it's still admittedly not close to the point where everyone who would want a test can get one. We very much want that to be a reality as soon as those large labs can get online.
This is a question for Dr. Stack. Yesterday, you may have seen the headline out of a border state, Ohio, where their health folks think that there may be 117,000 people in that state who are carriers of this. I don't know if you saw that, and if you can kind of put that into perspective for Kentucky, if you think there are that many are there a lot of people carrying this virus that just don't know it?
Let's not speculate.
Yeah, so I agree with the governor that speculation is not going to help, but what I would say is I'm in communication with my counterpart, the state health official in Ohio, and we share information and surveillance as we try to work through this. We showed you a graph up here yesterday, and the governor showed it again today, where epidemiologists are trying to model how this disease behaves. So we're using that kind of information, but we don't have enough data yet for me to give you a valid speculation about what the true burden of disease is.
Did you see that report, and were you concerned by those statements that a health official had made?
Well, we saw that report, and what it suggested to us is that we need to take the steps that we are taking to ensure that we act now and we don't act too late. Here in Kentucky, I don't want to speculate on a figure that we don't have widespread testing to really confirm. And I don't want to create additional fear in folks because, again, about 80% of people who get this we think will be asymptomatic or just a little bit sick and ultimately just fine. But we are taking the types of steps that would be necessary if that was to be a reality. And we are treating this like it could be very serious and how fast it spreads, and we know if we act now that it gives us our best chance to prevent it from spreading in a larger manner, and we got to make sure we don't overwhelm our healthcare facilities. So, being a part of Team Kentucky, remember to look at that infographic, and if you are well, but you're nervous, call the hotline. Don't go to a doctor's office or a healthcare facility. If you are sick, but otherwise would not seek care, in other words, allergies, basic cold, call the hotline. Talk to somebody there. Don't overwhelm our healthcare facilities. But if you are truly sick, would have sought care and or injured, go get the help you need. Yes.
Who's answering those hotline calls? Are they medical professionals? Are they?
It's been set up. It's set up through the Poison Control Hotline. Norton runs it through a contract with the state. They are getting a significant number of calls. I believe we got over 800 calls in a day. That data may be a day or two old. It may be 40 to 50 people in the range plus or minus. We are going to continue to keep that hotline open. We think it's a really important tool for people. All right, we will give another update about 5 o'clock today, and then we are likely to do one update on Saturday and one update on Sunday. I want everybody that's been here and here every day to practice self-care too. I'll let you sleep in just a little bit, but make sure you stay healthy, practice that good hygiene, take the steps you need to. I want to thank the media for how you've been getting this out responsibly. And again, push that good hygiene. This is one where even in this press room and everybody watching at home, we're all in it together. We're going to win as Team Kentucky. Let's all be good teammates. Thanks.